Good evening, everyone. I'm Kavya. It's my pleasure to welcome you all on behalf of Oasis Care Ayurveda Medical Center. Oasis Care Ayurveda Medical Center, established in 2014, and it's famous for its authentic Ayurvedic treatments. Today, we are here to unlock the Ayurvedic techniques and insights on the topic frozen shoulder. We are honored to have each and every one of you present here today, and we look forward to share our knowledge and passion for Ayurveda. So together, let us embark on a journey of well-being and embrace the timeless wisdom of Ayurveda. I invite Dr. Sheetal Kulkarni, Medical Director, Oasis Care Ayurveda Medical Center, to start today's session. If you have any questions, please write to us in the chat box, or you can unmute yourself and ask your concerns after the session. Thank you once again for joining us, and over to you, Doctor.
Thank you, Kavya, for your kind introduction. Yeah, we will start our session now. Today's session, as we all know, it's a topic of frozen shoulder. Just a second. The topic nowadays, it's a very famous topic and it's a very common topic nowadays of frozen shoulder. We will take a little bit of an introduction, what is frozen shoulder and what are the symptoms and what are the treatments we are doing in Oasis Care Ayurveda for frozen shoulder. And then we will take the question answers. Okay, so let's begin our session today. So what is frozen shoulder? Frozen shoulder is always called as, if it is any kind of a shoulder related injury, nowadays we are calling it as a frozen shoulder. But is it so? Is it only the shoulder injury is frozen shoulder? We will look after it now. Frozen shoulder happens when the tissue around the shoulder becomes inflamed, and the whatever is the tissue around the shoulder, it becomes shrink and very tight, and because of that the pain started. Okay, so many of us in our medical terminology called it as adhesive capsulitis and or the frozen shoulder. So it's usually because of the inflammation of that capsule it happened, and because of that the shoulder joint ligament and become very much inflamed, and because of that tightness happened and the bone is can't able to rotate it fast and nicely. Because of that the inflammation and pain happened. Now what are the signs and symptoms for frozen shoulder? So when the patient come here to us in Oasis Care Ayurveda, normally we see him as thoroughly as per our Ayurvedic terminology and as per the clinical diagnosis as well. The signs and symptoms mainly for a frozen shoulder will be in two stages. First, it will be very dull ache and it affects mainly the shoulder part. And maximum time the patient is telling us that the shoulder pain is very much more in the night time. So whenever they are moving from on their bed, it can't able to bear the pain. Okay, another symptom is the stiffness around the shoulder joint. Now, in frozen shoulder, there are many stages. In the main stage will be the 3 stages. We call it as adhesive capsulitis is the main presentation. Primarily, we can see it's a very painful and very disturbing condition. The condition progresses in 3 stages. First is freezing pain, freezing stage, which is very painful. Normally, patient tell us that they can't able to sleep at night and they can't able to perform their regular activities. And this pain will be the freezing kind of a stage. Second is the frozen and adhesive kind of a stage. And third is thawing stage. We will see it in a proper manner now. Now you can see in this picture that this is a humerus of the upper arm, the bone which is called humerus. This is the shoulder capsule. This is our collar bone.
Meeting.
This is
Meeting.
just move them. Okay, this is our collar bone, and this is the scapula. Scapula is the backside of our bone. Backside of our there is a triangular shaped bone, and which is attached by the collarbone and the humerus. And here is the shoulder capsule. When this capsule became very much inflamed, sometimes it is converted into the frozen shoulder. Okay. Now we'll go to the next one. Yeah. The frozen shoulder typically develops slowly in 3 stages, as I said. Now we are going to see the first freezing stage. Any movement in the shoulder will cause the pain in the first stage of freezing phase, and the shoulder become limited action, okay, in this stage. Then some patients will ask that since 2 months or since 2 months to 9 months, these kind of a pain is already there, doctor, and the pain is always dull, and in any kind of a movement, I am having the pain. So this will be a kind of a first stage, we can say. But in frozen kind of a stage, which will be the second type of a stage, the pain is less in this stage, but the joint from the shoulder and from the hand, this capsulitis is become more difficult to take the hand upside. Okay, the range of motion of the hand is become restricted in the second stage. As the first stage is very painful, the second stage the pain is less, but the hand restriction movement is more. So it is called as a frozen kind of a stage. And it is very much difficult, and the stage will be from 4 months to 9 months. It will be there. And the third stage is the thawing stage. In this stage, sometimes the improvement or sometimes the shoulder become very mobile sometimes, and the stages last for more than 24 months. Now we can see what are the causes for the frozen shoulder. The cause of frozen shoulder is not actually understood by the modern medicine, but in Ayurveda we will see afterwards what are the hetu or the causative factors for the frozen shoulder. For the sometimes because of the occupation also frozen shoulder happened, because of sometimes the typical position of hand, and typically we are sitting in a sedentary position sometimes, because of the many kind of systemic disease, even frozen shoulder happen, not only because of our lifestyle, because of some kind of diseases also, especially diabetes. Frozen shoulder occurs mainly in diabetic patient, and additionally frozen shoulder tend to get stiffer very fast in diabetic patient. Okay. Some additional medical problems will be hypothyroidism, sometimes hyperthyroidism. In this kind of a patients also we can see frozen shoulder very often. Parkinsonism diseases, some cardiac diseases also, frozen shoulder can be seen very commonly. And sometimes immobilization of the shoulder will also cause the frozen shoulder. Immobilization in the case of surgery. If anyone has a fallen history or any kind of a surgery regarding the shoulder or any kind of a fracture or anything, and the hand is immobilized for some days, then that will also be a cause of frozen shoulder. As I told, injury or the fracture is the main cause, and as the recovery stage is there, frozen shoulder can be seen in these stages also. Who are the people who are in risk for frozen shoulder? Sometimes it is nowadays we can see many patients, male and female, but mainly in female patients who are plus 40 plus, are maximum times having frozen shoulder. Okay. People who had keep shoulder somewhat still or in a high risk developing frozen shoulder, restricted movement can be a resulting factor of frozen shoulder, and sometimes rotatory cuff injuries, broken arm, or stroke, or a recovery from the surgery, as I told you. These are the risk factors for the frozen shoulder. Okay. Now, in systemic disease, as I told you, that the person who is already suffering from any kind of a disease, in this case, diabetic patient and hyperactive thyroidism, hypothyroidism, and cardiac patient and the Parkinsonism patients are more in the risk. Now we can see that how Ayurveda is looking for the frozen shoulder. Okay. Now, as we can see, what are the different factors, as Ayurveda is looking not keeping a name as a frozen shoulder only for the disease, but we have a differential diagnosis for frozen shoulder as well. In this, we are calling it as a apabahuka or amsa shosha or vishwachi or manyastamba. I'm not going very detail in that, but how Ayurveda is looking after frozen shoulder and how our treatment methodology or how our diagnostic methodology will be. First of all, as we all know that we see each and every patient in a different way, that each person have a different prakriti. Okay, so it's not a tailor-made kind of a treatment every time. So first is a prakriti. So what kind of a prakriti that patient is having, and sometimes specifically in Ayurvedic pariksha bhava or else in examination, we do as a Dashavida pariksha bhava, which are first it is coming under a prakriti. Sometimes if the vata kapha related prakriti is there, these kind of a people will have frozen shoulder very frequently, not always. But if the dushti is more of a vata kapha related prakriti, or the dushti is like that, then it is manyastamba kind of a vyadhi. In vikriti, what are the causative factors as per Ayurvedic terminology will be ahara. Ahara, which is our dietary regime, what kind of ahara the patient is taking. It is also all depend upon the Vyadhi Samprapti. So it is Vatakara Ahar Vihar and Kafakara Ahar Vihar. The diet which the patient is taking is of a very kind of a Vata Vardhaka Ahar, which is kind of a very dry, very ruksha, very fast eating habits, and kafakara ahar, which is always with very junk food, or always dadhi sevana, which is always with the curd and all, which is increasing kapha. That kind of a aharaja, if it is there, then it is a ahara hetu. Viharaja hetu is daily traveling. Yes, you may be thinking that is it so that why it is written that daily traveling? Traveling is a Vatakara Hetu in Ayurveda, and because of the too much of a traveling, Vata will increase. So whenever we are taking any kind of a history, we always ask the patient about their lifestyle, what kind of occupation they have, what kind of ahara they are taking, what kind of environment they are working. It is very important to see because of what kind of an environment and what kind of a situation they are working. Because of that, some kind of a doshas will increase, and due to that, some kind of vyadhis are also going to happen. So atiyana means in Sanskrit it's atiyana, which is daily travel. If it is there too much in Dubai, especially, some people are traveling 2 hours to and fro. So it is always a causative factor for frozen shoulder. Sometimes too much of a traveling is also, and in India or in many places, many people are going through two-wheelers, and that will be also a causative factor. It will be in an excessive amount of traveling, you can say, in continuous manner, which is the causative factor. Too much of a stress. Yes, too much of a stress will also a causative factor for frozen shoulder. Then dosha, as I told, vata kapha. I'm not going to go in too much of a detail, as I said. So we will see it in a many other way also. Sara, Samhanana, Pramana, Sattva, these all are actually very much Ayurveda terminology. I'm not going too much into detail of this. Yeah. Now, this is very interesting thing that how we can see that this, because of this reason, frozen shoulder is happening. And one kind of a nidana is akala bhojana. Nowadays, as per Ayurveda, we are always telling that your timing of eating should be in a proper way. Like your lunch should be before 2 o'clock. Your breakfast should be before 10 o'clock, and your dinner should be very early. At least nowadays, not we are telling that like sunset, before sunset or something like that, but at least before 8 o'clock. So why it is so? It is called as whenever there is a pachaka rasa in our stomach more, that time only if you are having ahara, it is going to digest properly. So why ahara is very important in any kind of a disease? Because of that only these doshas and all are not going to get aggravated. Okay, so in frozen shoulder, basically too much of a kala bhojana means any time if you are eating your food in a very different timings, that will be a causative factor for frozen shoulder. And why it is so? Because it is too much of a vata increasing factor will be there, and due to that the akala bhojana is the causative factor. Nitya dadhi sevana. Nitya dadhi sevana means daily, if someone is having curd, then it will be a causative factor also. And as we said, that atiyana means continuous traveling. Okay. Purva Rupa is how it get aggravated. That pain started first because of these kind of a nidana. How it is going to happen? It is too much of a pain. Slowly the dull ache and all the discomfort will start, and slowly the pain will start from the neck region to radiating towards the hand. Sometimes the weakness will be there on the upper limb, and stiffness of the arm will start. Okay. Now, how we Vaidya people are looking after this, as all the shoulder pain, as I told you, that it's not only frozen shoulder, it will be in a differential diagnosis also. So what differential diagnosis we are going to look after is sometimes it is bursitis or tendonitis, rotatory cuff injuries or cervical spondylosis or the frozen shoulder. These all kind of things which come under the shoulder pain. So many different criteria are there by which we are going to diagnose it if it is a frozen shoulder or not. Always we will look after it that every shoulder pain is not only frozen shoulder, as nowadays all of even the people who are coming regularly to us for the treatment, first whenever they are coming for the consultation, they will say that doctor, I am having the frozen shoulder. But after looking at it, after taking the proper history and the proper test, after doing it or the physical test, we can see it and no, it is not a frozen shoulder, but it's a rotatory cuff injury, or there is a bursitis. It's not a frozen shoulder. So because of what reason we are going to see it, there are some criteria that sometime the joint tenderness will be there, and during only movement the pain is there, or the pinching pain is also there. Sometimes the redness will be there too much or in the on the joint, or sometimes the only shoulder and arms are stiffness, but there is no strength in the arm. And especially in rotatory cuff injuries, the muscle stiffness is too much and the weakness is also there. But if whenever there are some kind of different kind of a good physical examinations, like MT can test and other test also, some ARC kind of a test also. In this, some passive movements we are performing, then we can see the patient can take the arm up, but without passive movements, if they are not taking the hands up, then we can diagnose it as this is not a kind of a rotatory cuff, but it is a frozen shoulder. Okay. Now, in Appabahuka, that is, we can say that frozen shoulder differential diagnosis according to Ayurveda. It affects the Amsa Sandhi, means the shoulder joint, and because of the Vata deterioration of the arm, this will happen. As you can see that this kind of a joint is a ball and socket kind of a joint. And in Amsa Shosha, as I am telling the differential diagnosis, wasting of a shoulder muscles are more in this disease. And next stage of the Amsa Shula will be the restricted movements and will be manifested. Now we can see the treatment part, which is kind of a different treatments are there in frozen shoulder. In this Bruhana Nasya and Bruhana Snehapana is a kind of one type of treatment, as well as some kind of a Panchakarma are also needed in this. These are only names of our Panchakarmas, but as per the patient's need and as per the doshic dominance only, we are going to see that which type of a treatment is needed. If it is a Patarpanajanya or if it is a Santarpanajanya, accordingly we are looking at it. Now, the main part of frozen shoulder treatment is a Svedana, which is fomentation. This different kind of a Svedana treatment we are recommending. In this Snigdha Ruksha and Snigdha Ruksha, both kind of a treatments we are recommending. In this Patrapinda Sveda, I am going to show you the photos also, so you can relate it. These kind of potlies we are using, and these kind of fomentation kind of treatments we are using for frozen shoulders. These we called as a kizi, and this is kind of a one kind of a Svedana. It is fomentation treatment. Okay, now one kind of a treatment as per the disease and as per the stages, the treatment are differ. And this is one of the treatment called as a lepa application. Many lepas we are using in this Jatamayadi lepam, different kind of Kottam Chukkadi lepam, as per the Vyadhi and the Vadhi condition and the stage of the treatment also, stage of the disease also, the treatment may vary. These are the lepa application and these herbs we are using in it. Now the Sveda, as we saw the first photo in this, whenever there is a avastha, means different stages, there are different kind of a treatment. As I said, the Svedana or the potli is also different in different stages. Whenever there is not too much of a swelling or there is a reduction of swelling is there, then we are going to start the Niramavastha kind of a disease. Then Jambira Pinda Sveda, Shashtika Shali Pinda Sveda, and Arkapatra Sveda we are using. And whenever there is a Kapha Bahulya is there and there is a dryness, a dry kind of a Sveda is needed, in that conditions we are using Valuka Sveda, Churna Pinda Sveda, Pariseka or Dharma Sveda or Panaha kind of a Sveda. This is our one kind of a treatment called Pidinchil, which is a Drava kind of Sveda. Okay. Up to this, if anyone is having any kind of doubt or anything, just tell me, and if I am audible properly, just anyone can tell me. I'm audible?
Yes.
Yeah, thank you so much. Okay. Yeah. Now, many of the people, why I have kept the post-treatment physical exercise slide also in this, it is purposely I have kept, because sometimes people may think that I have a frozen shoulder and if I can do the exercises very immediately during the pain also. So whenever there is a stage called painful stage, which is the first kind of a stage, it is not recommended to do any kind of exercises in the inflammatory stage. And whenever the patient is coming to our clinic and the consultation is there, we always tell the patient not to do any kind of exercise or any stretches during that stage. As the treatment progresses, as the inflammation come down, the changes in the movement we can see, and then only we are recommending any kind of stretches or any kind of exercises for the patients. Then specific exercises will restore the motion, and we are always telling the patient that you should do the exercises under the supervision. And whenever there is a proper instructor, they need to tell you the stretchings and range of motion kind of exercises. Then only you have to do the exercises. Sometimes heat is used to loosen up the shoulder, and then only you can start the stretching exercises. These all are these all the pictures of the exercises which normally frozen shoulder people can do. And these are very simple kind of exercises they can do in a home also. Yeah, I'm not stretching the session too much technically, as this is a Q&A session. So we can even anyone can ask the questions also. And if anyone is having any kind of a doubt, they can ask now. Yeah. Yeah, we can take this one. Is it better to rest or exercise for frozen shoulder? Mr. Praveen has been asking this. And one more question is also there. Yeah. Mr. Praveen, actually, as I told you that as per the stages only, we are going to tell the patient about the exercises, but you can do the exercises after the treatment and as per the recommendation of your doctor only. It is better to take rest during the sessions, as normally we are telling the patient not to do any kind of exercises during the sessions when they are taking the treatment here. Okay. Mrs. Arviz was asking which Ayurveda treatments are recommended for frozen shoulder. As I told you, that just a second. There are many kind of a treatments regarding Svedana kind of a chikitsa is recommended here uh, in Ayurveda. And as I showed the pictures also, which is Lepa treatment, some kind of a Pichu, some kind of a Nasya kind of a treatments are also recommended. I forgot to put the Nasya treatment, Nasya photo in that. Actually, Nasya is a main treatment for the frozen shoulder even. Even the Pichu applications and all are also very good. As per the treatment, as per the disease condition and the stages, the treatment may differ.
What are the? What are the question? In the question.
All frozen.
Yeah. Can stiff neck leads to frozen shoulder? Actually, ma'am, stiff neck can lead to frozen shoulder, yes, but we need to see the what kind of um, symptoms are there for your neck stiffness. Sometimes, as I mentioned, that differential diagnosis in sometimes in the cervical spondylosis also stiffness of a neck will happen. But yes, frozen shoulder can lead, means stiffness can lead to frozen shoulder as well. You can see the doctor first for the consultation, and then only we can tell you if it is a frozen shoulder or not. Frozen shoulder, what to do? Okay. Actually, ma'am, if you are going through the frozen shoulder kind of symptoms, we are always here to serve you. Our center is located in Karama, Dubai, and we will post you the address and the phone numbers now. Whenever you have time, you can book the appointment for consultation, and as per the consultation only, we will see how is the condition and the treatment we are going to give. Okay. Okay. Any other questions? Okay. What are the precautionary measures to avoid? Okay. Actually, whenever when patient is coming to us, the precautionary methods we are telling to the patient while they are taking the treatment, not to do the exercises suddenly. Sometimes what happened, patient comes to us and they feel the symptoms are a little lesser and they start doing the exercises thinking that now I'm good. But normally we are telling that as the inflammation come down, don't do the exercises very fast, or don't sit in the AC or directly on too much of a wind, or always keep yourself a little warm. And some kind of a dietary regimes also we are telling them to follow. If the patient is doing any kind of a panchakarma during the treatment, then yes, many kind of a precautionary methods for the panchakarma, the dietary methods are also recommended, and as per that only, if they follow it properly, then the results are very good. Okay, how Nasya treatment help in frozen shoulder? It's a very good question actually. As many people may think that Nasya is the nose related treatment, and how it is going to help for our frozen shoulder. As in Ayurveda, Urdhva Chaturagata Vyadhi, any kind of a disease which is above your neck region, Nasya kind of a treatment is a Shodhana Panchakarma kind of a treatment. And in frozen shoulder, normally Bruhana kind of a Nasya treatments are always recommended as per our Ayurveda text. And it is very good Bruhana kind of a chikitsa as we are going to give for the frozen shoulder. So Nasya is a very good treatment for frozen shoulder and very good results are there. Okay, Rima ma'am is asking upper arm, there is a pain inside, not always, and when lift, sometimes sudden pain is there. Yes, ma'am. As I told you, that if you have a pain in the upper arm, and if it is the not regularly, it's painful. Then if you can see that, if you can come here, we can see the other test also. And sometimes it may not be a frozen shoulder even. It must be some kind of a, or if it is a frozen shoulder, if it is a stage 1, we can treat it very nicely. You can come for the consultation anytime. Okay. Yeah. Hope you all have your doubts cleared. And if any kind of doubts are there, you can post on our WhatsApp number also. And you can follow us on our Facebook and Instagram. Even the numbers are there also on our Facebook and Instagram pages. And anytime you can meet us for the consultation. Okay, our center is open from morning 9 to evening 9. And all our therapists are well trained, and our clinic is under Dubai Healthcare Authority. So yeah, you can come anytime. Okay. Thank you everyone for your time and the questions. Thank you. You can take your leave now.
Yeah, thank you, doctor.
Yeah, welcome, sir.